life. See me, Lauren? Farah? Hello, everybody. I am so happy to be with a very special guest, Dr. Farah Laurent. She is a nurse and a career coach for nurses. She helps them to get the job they want. We know that nurses are a big pillar of healthcare delivery, and I have the highest respect for all the nurses. I'm very humbled for Dr. Farah to be here with us. As you can see, she's in the car. She's on her lunch break, and she showed up to be here with us. So welcome, Farah.
Hi, thank you for having me. I'm so excited to be here and to, have this chat with you, Dr. Nadia.
That's awesome. You can call me Nadia. So, in your own words, can you introduce yourself to our audience? Dr. Farah has so many credentials that it will take me 10 minutes to go over them. But in your own words, please introduce yourself to our audience.
Sure. So I basically am a nurse, over 20 years of experience, background in emergency medicine, education, and leadership. And I'm currently in an academia role in leadership director of nursing. And I'm an entrepreneur, really trying to make my transition to full entrepreneurship. I'm an author. I wrote a book, self-published myself, called Nurses Making Money Moves, A Nurse's Guide to Starting a Business. I also coach nurses, as Nadia mentioned, on career, really guidance, development, interviews, resumes, things like that, and really how to advance in the nursing career, in the nursing field. And I've worked in Canada, I've worked in the US, all over the US in different states, and recently just got my doctorate in organizational leadership. So it's really exciting for me. Thank you. And I did my doctoral work in stress reduction strategies for nurses. So I'm really excited about, creating really, uh, really great work environments, not just in
Yeah.
the nursing world, but in other corporate areas, because I think that's really important. And I'm also a speaker. I speak at different nursing conferences and, other events as well. So that's kind of in a nutshell about me. So thank you again for having me.
Yeah, absolutely. To build on your doctoral work, congratulations, you're a recent grad as of
Thank
last
you.
week.
Hmm.
Yeah, so
Thank
we
you.
know that the healthcare workforce in general, and nurses particularly, are experiencing a lot of burnout. Can you comment on how are they feeling? How's the life in walking the shoe of a nurse for a day? What is it like?
So one thing that I like to do, especially on LinkedIn, is educate also the public what nurses do, because I think sometimes the public may have a very narrow view of what nurses do, because typically they think nurses really just work in the hospital setting and do bedside care, which is a big part of nursing. However, there are nurses who are, researchers, scientists
Yeah,
who work in different settings, like in academia, public health, remote. There are so many, and this is why I love our profession. There's so many roles, and I did a LinkedIn Live. There's like actually over 80 roles, probably more. And a lot of nurses are going into entrepreneurship
hmm,
because they're wanting to stay away from bedside, and that's not a bad thing. And that's why, my story is I want to empower nurses to really do what it is that they want. But obviously, yes, as you mentioned, there are a lot of nurses who are burnt out. I myself, without realizing, was burnt out in emergency medicine because I was a former ER nurse, and I absolutely loved it. I was very passionate about
yeah,
it. But there came a time where I was frustrated with the healthcare system in itself, both in Canada and the US, because we know there's a lot of complexities when it comes to delivering healthcare, safety, and the quality of healthcare. So, nurses really what they want to do is to provide the best care to patients and to keep them safe. And it's like we're kind of in a hard place because of all the constraints,
yeah,
financial constraints, because organizations want to save money because they're also a business, especially in the structure in the United States is very different than healthcare in Canada. So I know, they're trying to build a business as well as the organization, but then also the patients suffer. And nurses don't want to see that, right? And then a lot of expectations are put on nurses, such as some organizations don't want to give nurses the full amount of education that they need to thrive. So if you're a brand new nurse, you should really have about at least 12 weeks of orientation if you're going to be at the bedside,
Oh, wow.
depending what areas you're going into. If you're going into a
Mhm,
more critical care area like the OR,
mhm.
you need specialized training. You need at least 6 months, depending on what type of surgeries you're doing.
Yeah,
Or if you're going into critical care like ICU or emergency medicine, you at least need 4 to 6 months to really know what you're doing.
yeah.
But they're throwing these nurses in there at like 6 weeks or
Mm.
sometimes 8 weeks. So of course they feel frustrated. And the last stat I had, it's like about 1 in 5 nurses will leave the profession in their first year. So
Wow,
I
in the
love,
first year.
yeah, or and then more in the second because they feel unsupported, right?
Hmm.
So I love the nursing profession. I always try to, keep the positivity, but I also
Yeah,
bring the reality to it. So I
yeah.
think that's kind of where the nurses are really struggling,
Okay.
because they want to provide the best care, but there's a lot of different complexities and constraints. So,
I see. Yeah, I've been talking recently to a chief of medicine in a large hospital system. And again, I asked, hey, how's it going? And so on. And he mentioned something there is a lot of pressure on healthcare systems because they are losing a lot of nurses.
hmm
They're losing nurses that will go, and then they are almost forced to rehire them as a locum, which is costing them even more.
hmm
And so, what's your take on that, like exodus from the nursing profession within healthcare systems, at least here in the US?
so within the U.S., I honestly think nurses are kind of fed up. You've seen a lot of strikes happening
Hmm.
all over,
Yeah.
places like New York, New Jersey, and some other states. And I
Hmm.
think it's because they're just tired of, like you said, that pressure, right? Especially bedside nurses,
Yeah.
because they're risking their lives, to take care of patients, and they're not being treated well. So, meaning treated well, not just in the amount of money that they're paid, but even in terms of the whole package and compensation, right? So sometimes they're expected to work overtime, like mandatory overtime.
Hmm.
And if they want to have time off, sometimes they're denied that time
Okay.
off for PTO. So of course they're frustrated, and there's a big issue in leadership. So obviously, I was in the multiple leadership positions. Um, you know, there was a leadership position as the director of education, and I felt like sometimes it was difficult because the C-suite, sometimes their initiatives and motives are not really, sometimes it's more right, like a business focus, so they're not really listening to exactly what the front line needs.
Yeah.
They might have all these like fluffy initiatives, we care about nurses and all this, but we know in reality they're not really supporting nurses as they should
Mhm.
be. They're short staff, and then they don't want to provide overtime. So what
Mhm.
happens? The nurses call out sick more, and then they end up leaving. But then it costs the organization more money because
Yeah.
we know that
Mhm.
retention, right? It's like a constant revolving door, and then you have
Yeah.
to you have to hire travel nurses,
Yep.
right? So it's a very complex issue, but I think if they give nurses the appropriate leadership training so that they can have better nurse leaders, and
Hmm.
that they can have better nurse leaders that are also diverse, because a lot of places, and I'm very straightforward when I say this, there's not a lot of diversity in leadership, right?
Hmm.
So that's another issue. We need to have succession, I can never say it, succession planning,
Succession. Yeah.
where it's, you're mentoring all different types of nurses to get to these positions, not just like, white males that are
Hmm.
old, right, or whatever it is, because that's really truthfully what's happening. So leadership is an issue. I think they need to do a better job with providing training
Yep.
so they can have better leaders,
Hmm.
and also just treating nurses in general just better so you can retain them, so
I
I know
see.
that's a lot.
Yeah, yeah, that's a lot. And we need to talk about this because ultimately it's the patients that suffer from all these complexities and
Right.
that pressure that's on a key player in the healthcare delivery system. So we know that with tech, it impacts, our health care delivery.
Hmm.
And how do you see tech within the nursing field? And what does it mean, like from an everyday practice? You mentioned you need like up to 3 months to 6 months, depending on where you're working at in terms of training. Where does the tech fit into this?
So I think obviously, as we know, technology is always advancing, it's always changing in every industry and as well as healthcare. And I think it's really improved healthcare a lot, and it's really made it more efficient in a lot of ways. So one way in nursing in particular is the electronic medical records, right? The EMRs, because back in the day when I started in Canada, it was paper charting, and there were clipboards. So we had to go around, look for the chart. If somebody, if a consulting physician came, we couldn't find the chart, right? So really, the EMR alone has really transformed the way we take care of patients. In terms of safety, it's a lot safer because things are in the computer. There's a lot of verification. Pharmacy plays a big role, right? So I feel that now, even though there's still issues with fragmentation, like fragmented care in healthcare, I feel like now technology has improved coordination of care. So, meaning EMRs, if you're in a health system and you go to one campus versus another, now they can see your health, history instead of asking the patient the same thing over and over. Other things like barcode scanning for medications, even though it's not, the end all be all, as a human, you should still triple check because there could still be errors. It's really helped in safety, right? Not giving the wrong medication, things like that. And then efficiency in charting. It's really helped nurses minimize charting in some aspects, but then it depends on the organization. Sometimes there's more charting that happens, but really, I think overall, it's made it more efficient. And then in other ways, in terms of detection, so now things like AI, there's AI software that's detecting breast cancer, for example, things like that, that they just started using about, within the last year. And it's picking up things that, radiologists wouldn't necessarily see. So I think, there's been some great advances. And I think nurses just have to really learn to adapt because
Yeah,
there's a lot of different multi generational nurses working together. So obviously, the newer generations might be a little bit more,
yeah,
be able to adapt faster. And some of the nurses were probably ready to retire. It's difficult sometimes for them to adapt.
yeah. You read my mind. I was gonna comment on the older, nurses workforce that are closer to retirement, which I think would put even more pressure on the
Mhm.
health systems. So, how do you see? First thing you mentioned, you already hinted to it in terms of, the adoption of new tech.
Mhm.
How do you see that dynamic between different generations of nurses in terms of training them using these tech to hopefully make their jobs easier?
So as we know, in general, in any industry, change is, very difficult. So change management is very important when you're a leader, obviously, right? So different things like communicating in advance what the changes will be is very important, and doing it really in a timely fashion, you know, not just like, oh, next week we're going to implement this, right? Because that's very difficult. So, especially for the older nurses, you want to give them ample time to say, hey, this is coming, this is how you should prepare. And prepare the nurses before it actually gets there, right? And seeing how it's going to affect patients and impact the workflows, right? So really doing a lot in quality. They do what is it called? I can't remember. It's like the plan, do, study, act, or whatever it is. They have to test things a couple times before they actually go ahead and implement it. So I think that's huge, the change management part, and communication, because and communication in multiple forms, right?
Yeah,
Not just like, let me just send one email, because some people may not read that
read it.
email.
Yeah.
right? You have to have maybe a town hall about it, or written email. You have to have multiple forms so that
Mhm.
people know way in advance, and then you have to have a lot of support from, say, the IT departments to be there to support. And then when there are go lives, for example, like Epic is a big EMR that a lot
Yeah.
of
Mhm.
places are transitioning to. It's a lot of work. They're hiring project managers and things like that behind the scenes to really make all of this work. So I think, really working as a team and communication and planning is just is huge.
Awesome. That's
And
awesome.
giving opportunities for questions, because a lot of nurses will ask, so that's
Yeah.
one big one.
You mentioned like the top to bottom approach in terms of, initiatives, and then it trickles down. I think it's the should be the other way around, from the bottom up. Get feedback, what the front
Hmm.
facing, forward facing healthcare professionals are need, and then you fit it into
Yeah.
their workflows, because they know, excuse me, they know best what how they deliver the workflows, where the roadblocks are, where the bottlenecks are, what
Yep.
could be improved. Because if you go from the top down, it's much harder to implement, as opposed to involving the people that are doing the work. So, um,
Hmm.
and you mentioned Epic as a major EMR, and I know they do have some AI capabilities. What's your take on incorporating AI into the healthcare delivery from a nurse's standpoint? What's your viewpoint?
So I wanted to touch base on what you said earlier. I absolutely agree, because as a staff nurse, we used to get pissed off when, upper management wouldn't really ask the frontline workers our input. And that's exactly what I was saying about that change management, just definitely incorporating feedback, because you need to test it out, right? To see if it's going to work, and if it's even, um, like you said, going to be good for the team. But yeah, AI, I'm all about AI. I think it's not going to go away, and some nurses, or even just people in general, not even in the healthcare industry, I think are afraid of it. But if you think about it, I think it's been around even before. I'm not an expert in AI, but I know that it can really save time and really be efficient and really help physicians out, and it can really advance, I think, the healthcare profession. So I think it's here to stay. And I think they just need to offer more courses on it, and really understanding AI, so it can eliminate some of the anxiety and fear that's going around with AI, because I think there's a lot of misconceptions. So I think probably organizations, if they do want to implement it, they should just do more education around it, to really have it be more received a little bit more from nurses and other healthcare professionals.
That's awesome. You mentioned there is a little, uncertainty and plus the overwhelm. What advice would you have to nurses who feel both overwhelmed by these rapid technological changes, and also they're already close to burnout? So, what advice would you give them from that standpoint
So
in
I'm somebody
relation
who's
to
very,
technology?
I'm very laid back. So that's just my type of personality. And I like to just test things out and try things out. And coming from my background of emergency medicine, that's just the type of nurse that I always was. Like, you never know what's going to happen. So you just have to be ready for anything and kind of adapt. And I think most nurses could probably learn, not just with AI and technology, but I think the one of the best skills is just to be flexible and learn how to adapt, right? Not only with tech, but it's things are constantly going to change, right? So whether it's like working with a new team, or you're going to be in a different area, that is probably one of the strongest skills that you can have, is just being adaptable and just rolling with it, because we talk about in nursing, it's a lifelong profession of learning. So we constantly have to be updating ourselves, taking continuing education on different topics. So that's probably the best advice I would say, is continue to learn, and don't take things so seriously. Just relax.
Yeah,
it's not going to go away. So you just have to adapt and ask your colleagues for help. Ask other experts, reach out to leadership or whatever it is that you need to do. Because, and if you don't like it, then maybe you should find another type of area of nursing that maybe fits a little better with your style. So maybe you need to be in a controlled environment that, there's not so much rapid change. Maybe look at something like that, because there are so many different opportunities in nursing. And that's what I do as a nurse career coach is I help nurses who are frustrated or maybe new nurses that have no idea what area to go into because they're so overwhelmed with the
Yeah.
options. I really help direct and find clarity, and guide them to what it is that they should do. Because if you're not happy in an area, there's some other areas that you can go to.
Yeah, and
That's
as
the
you
beauty.
mentioned, yeah, you mentioned about 80 different roles that the nurses can do, which is mind-boggling. And Farah, do you have like an experience for tech and emergency nursing, uh, and how it impacted your patient care to share with us?
Yeah, so there was one in particular. It was something simple. It was just like being in the trauma room, or sometimes we call it the resuscitation room. The monitors, mostly we had Philips monitors in some places that I worked, and some level one trauma centers. What would happen is, and this was something, even though some people may not think it's a big deal, to us it was. So we would have, say, automatic blood pressures or vital signs. We could put it, say, like every 5 minutes or every 10 minutes, say it was a critical care patient. And what would happen is those vital signs would automatically go into Epic, and they would just transfer to that cadence of how many vitals we needed. And that was huge because instead of us just having to go to the computer each time and inputting that, the vitals would transfer automatically. So that was, huge and really efficient for us, especially in critical care, in emergencies and times of critical care. You would just have your vitals there in the charts,
That's
So
awesome.
that was
That's a
one
great,
example.
yeah, that's a great example. And in terms of looking, if I zoom out with how many, the pressure on nurses, the health systems, a lot of nurses getting close to retirement. How do you see the involvement of experienced nurses in terms of these new technologies, training those new AI systems to help them into the future? Because they have so much body of knowledge and experience that's super helpful. And I really think it would be a missed opportunity if they're not involved in training those AI systems for healthcare delivery. What's your take on that?
So again, like I said, I'm not an expert in tech and AI. However, there's a big field of nursing that's growing, that's called nursing informatics. So a lot of nurses are going into nursing or informatics, and I think that's probably the field that would be most prepared to really, take on these tech roles and to help facilitate a lot of this education because they've been trained to do so, and they're more into the tech world and they like that, right? They're really passionate about it. So I think for the nurses maybe that are not in informatics, that's a place that they can look towards potentially. Or if they're just really good at tech, they can just volunteer and say, hey, I'm really good at this stuff, I would love to train, and then maybe work as an educator, or try to get an educator role. Because you don't necessarily have to be a nurse in informatics to be able to train or help, right? So that's kind of my advice on that. If you're really into that tech stuff, look at nursing informatics because I think that would be a good area.
That's awesome. Do you have any like top three advice you would share with new nurses that are, maybe overwhelmed, maybe trying to gain clarity about what field of nursing they want to go into?
Yeah, I love this stuff. So I have a lot. So number one, I would say don't listen to other people really take the time to reflect and see what it is that you enjoy. So maybe in your clinical rotations, really pay attention, if you like pediatrics, obstetrics, whatever it is. And don't listen to your nursing instructors, because that's what they told me. They told me I would never be an ER nurse. She laughed at me and she told me that I should work in med surg. And I was like, whatever, lady, just watch me. I'm going to go into the ER and be one of the most badass ER nurses around. So that's what I did. And I really say follow your heart and follow your passion, because you're the one that's going to be going there every day to work, right? So don't do something that you're not passionate about. If you're passionate about babies, go work with the babies, right? Or if you like public health, do that. So that's my first advice. You have to do the work and really reflect. And obviously, if you need help, you can call me, because I'm a nurse career coach.
That's
And then
awesome.
number two, I would say, look at your kind of what your end goal is, right?
Mm-hmm.
So maybe you want to go into leadership or something like that. So start creating a career and be strategic about it, of how you can get there faster,
Mm-hmm.
and pick the roles that you would need to get there. And one advice that I say is, like, go ahead and look at, if you want to be a CNO, which is like a chief nursing officer, go
Mm-hmm.
right now and look at what the a posting looks like. Look at the qualifications, look at what they need, and work towards that, because that's like your blueprint to be able to get to that leadership position. Same thing with like a CRNA. Like if you want to go into nurse anesthesia, you know that you have to go into ICU first to be able to get into those programs. So that's something that's huge. So work backwards, see what your end goal is, and work towards that. And then I also would say, um, create create a job or a career around what your lifestyle is, right? So you need to plan out what your lifestyle is. Like if you're a mom like us that has kids, you know, you want to be able to build a life for your family, and not just pick something in your career that's not going to match your family or your lifestyle, because you're not going to be happy. And then thirdly, I would say get a mentor or a nurse career coach, because even if you don't work with me, this is something that I regret not doing early on. You don't have to just get one mentor. You can get multiple mentors, because there's different perspectives that can help you grow and help guide you along the way. So I think mentorship is huge. And it doesn't necessarily even have to be just a nurse. Yes, it would be nice, but you can also get mentors who are not in nursing. Maybe you want to
Yeah.
go into business. Get somebody who's an expert in that area that can help you
Mm-hmm.
grow.
Yep, that's awesome. And if anybody watching this live or watching the recording and they would love to get in touch with you, they can book time with you on LinkedIn. They check your featured section and you can have a free call if you need help getting that clarity in your nursing career. And
Yeah.
that was the shortest 30 minutes I've had in a long time. And on my end, what I do, I help business leaders grow by leveraging innovations, including artificial intelligence. I put together this blueprint for business leaders. You can find it on my LinkedIn featured section as well. And with that, thank you so much, Farah, for taking time over your lunch break to go into a parking lot and talk to
My
us
pleasure.
live. Yeah, I highly recommend if you're looking for a highly energetic, passionate nurses coach to get in touch. Follow Lauren, ring her bell, and get in touch with her. At least talk to her. It's free of charge for, I think, 15, 20 minutes or 30.
Yeah, 30 minutes they can do that. And then if they want to learn more about me, they can also just go to my website, nursefair.com. But
Mm-hmm.
LinkedIn is probably the best way to connect with me. And
Mm-hmm.
Nadia is amazing. You should also connect with her
Thank
and
you.
book calls with her. She's really, really awesome
Thanks a
at what
lot.
she does, and has won like all these awards and everything. So she's
That's
really great.
awesome. Well, thank you, Lauren, and all my best. And thanks a lot
Thank
for
you.
whoever is watching us live or on the recorded session. If you have questions, pop them in the comment section and I'll take a look at them later. And Lauren, too.
Thank you so
Take
much.
care, everybody. Bye.
Bye. Have a good day. Thank you.